Imagine that I'm a Coumadin patient feeling slightly bewildered and isolated, so I open my Heartizi app, which is centered around this daily to-do list. Coumadin doses are displayed in milligrams and tablet images, making it easy for me to know exactly what to do on any given day. As you probably know, Coumadin dosing is highly individualized. Patients often take different doses on different days, and errors are all too common. I can see how well I'm doing with my Coumadin therapy with this trend line providing simple visual feedback, displaying the INR over time, or the blood test used to follow how thin the blood is. I can now easily submit status updates to the clinic using my device in a structured fashion, including new medications, changes in diet and alcohol intake, and bleeding symptoms, providing important context for treatment decision-making, and currently requiring time-consuming phone calls. In addition, I can submit non-emergency anticoagulation-related questions to the clinic and receive responses directly on my device. After checking my blood at home, I can enter my INR result into the system, and this is reported directly to the clinic. Over on the clinic interface, now imagine that I'm the Coumadin clinic nurse. I see a list of patients who may need some attention today, stratified by urgency and acuity, as well as a clinic-level display of the time and therapeutic range, an indicator of the quality of anticoagulation management. Opening our sample patient's clinic view, we can see the last reported INR, the target INR range, the current Coumadin dosing regimen, and any status updates reported by the patient since the last INR check, important information needed to formulate a new dosing regimen. Sending the new dose instruction is as simple as either selecting continue current dosing, selecting booster or skip doses, and most importantly, entering in the new weekly dose regimen, scheduling the next INR check date, and clicking on submit. What we just did takes the place of contacting the patient by telephone, which currently often requires multiple rounds of time-consuming phone tag, and in fact, clinics expend a lot of time and energy simply reaching patients by phone. Over on the right, imagine I'm the clinic patient again. I receive a notification that a new dose summary is available. I review a summary of the dose instructions that were just sent, and if everything looks reasonable, tap on Acknowledge. The new Coumadin doses are now automatically updated in the daily to-do list, so again I know exactly what to take on any given day. Daily reminders prompt me to take my doses daily and to check my INR on the next scheduled date, and the loop is closed. This platform is currently being extended to other medical conditions characterized by complex and dynamic therapies, including congestive heart failure, heart rhythm management, and post-cardiac surgical states, with the goal of improving the quality of remote cardiac care overall. In summary, we built the Heartizi system to make the difficult easy.